Welcome to the Salmon Runs YouTube. Enjoy the video.
You begin by stabilizing essentials so therapies can work. First, normalize sleep and basic routines. Consistent 7-9-hour sleep helps mood regulation. Once done, reach out. Call one trusted person or your clinician. If urgent, use emergency or crisis resources. Make tiny, clear goals. A 10-20-minute walk, a non-zero step toward meals and hydration. These actions change brain chemistry slowly and give you agency. Keep notes on what you did so you can build momentum and report details to your care team. Now you move into structured treatment. Begin evidence-based psychotherapy, CBT, interpersonal therapy, or DBT, because methods teach skills that change thought patterns and behavior. Make sure to coordinate with a prescriber about medication if recommended. Discuss expected effects, side effects, and a clear 4-8-week check-in timeline. Simultaneously, layer lifestyle supports. Exercise 3 times per week, balanced meals, and 15-30 minutes of morning light exposure to reset circadian rhythm. Keep a simple symptom log to measure progress. To finish, build a maintenance and relapse prevention plan so gains last. You identify warning signs and list exact coping steps, appointment cadence, and emergency contacts. Share this with one supportive person. If stopping medication is considered, do it only with clinician guidance and gradual tapering while monitoring symptoms closely. If you notice worsening, intensified thoughts, loss of function, or safety concerns, act immediately. Contact your clinician, use crisis services, or go to an emergency room. This troubleshooting step protects your recovery.
Thanks for watching. Consider subscribing if we helped you.